So, Dr. Trehan, the first question is, can diabetes be reversed? As we know, it's a lifestyle disorder. There are two type of diabetes, type 1 and type 2. So, first thing everybody wants to know is, can diabetes be reversed?
Uh, yes, Shivani, it can be. Diabetes is a lifestyle disorder, and nowadays people are ignoring their health. Moreover, environmental issues are also playing their role. Optimal health does not happen by itself. It needs to be nurtured and guarded. Much depends on the healthy nutritional choices, difficult to make without awareness of principles and some of the science behind them. It is a disease that affects the body's ability to produce or use the hormone insulin. When your body turns the food you eat into energy, it is also called as sugar or glucose. Insulin acts as a key to help transport this to the cells. Now, if you produce little or no insulin or are insulin resistant, too much sugar remains in your blood. And for this, we must first need to understand the sugar metabolism in our body. The carbohydrates, as you know, we eat are broken down into simple sugars like glucose through the process of digestion. I'm not going into the detailed process of digestion.
Right.
It will take much more time. So this glucose can then enter the bloodstream. Under normal conditions, whenever the sugar levels in our blood rise, a signal is sent to the pancreas to release insulin. This hormone acts like a key that triggers the insulin receptors in the cells, allowing the sugar to enter the cell. Now, the higher the level of sugar in the blood, the higher will be the amount of insulin released by pancreas. Right? Now, sugar glucose is the form of energy that our cells can use. It is the food for the cell, without which the cells cannot function. Shivani, as you can imagine, our muscle cells need plenty of energy for day-to-day movements.
Absolutely.
In case the sugar is not fully utilized by the cell converts it into fat, which can be stored for rainy days. That is a day of starvation.
Right.
We will talk about the most common type of diabetes prevalent today. That is type 2 diabetes. Understanding diabetes starts with knowing the difference between type 1 and type 2 diabetes. Currently, 85 to 90% of diabetes are type 2 diabetes. In these cases, nutritional treatment is usually started later in when the allopathy fails, because allopathy used to control the sugar, but the allopathic treatment also start with medicines rather than insulin.
Hmm.
Right? If the
Right.
amount of fat increases within the cell, it stands to reason that the cells do not require any more sugar because it already has plenty of energy stored. Therefore, the fat within the muscle cells prevent more sugar from entering by making the cells insulin resistant. If we continue to eat sugar or carbohydrates, which break down into sugar, this excess sugar now remains in the bloodstream, causing a rise in the blood sugar levels.
Right.
In order to remove this excess glucose, our thirst increases. That is the most common symptom of diabetes, so that the water we drink can dilute the glucose. This is then filtered and the kidneys by the kidneys and is thrown out, and that's why urination increases. This is also a most common symptom of diabetes.
Absolutely.
In order to use the accumulated fat in the muscle cells, the cell must spend some energy to reconvert the fat back to sugar so that it can be used. The only form of energy that a cell can use is sugar, or to be precise, glucose. So, when this fat in the muscle cells rises, it becomes resistant to insulin, thereby causing the blood sugar level to rise. This is called type 2 diabetes. And yes, it can be reversed through phytomedicine and through lifestyle changes.
Absolutely.